Hey, welcome back to my YouTube channel. My name is Maureen Sullivan. I'm a registered nurse and a certified diabetic educator. Today is video number 8 of a 10-day self-challenge to do 10 videos in 10 days on all things diabetic. So again, I'm a registered nurse and a certified diabetic educator. Today's video is on the test known as the hemoglobin A1C or A1C. It is done on diabetics to confirm diabetes or suspected diabetes. It has a blood test parameter of the following numbers here. A normal A1C level is below 5.7%. A pre-diabetic situation is 5.7 to 6.4%, and above 6.5% is believed to be a confirmatory test for diabetes. So I'm going to throw a lot of numbers at you. The numbers are coming from the American Diabetic Association and the Centers for Disease Control and Prevention, as well as the World Health Organization. So they're all reputable sites here. I do have some notes here, so if I'm not looking at the camera, I'm looking down at the notes here. But what is a hemoglobin A1C test do? So, and I want to read this to you. It measures the percentage of hemoglobin proteins in the red blood cell that are coated with sugar or glycated. So that's where the hemoglobin glycation test comes from, because glucose sticks to your red blood cells. So why is the test only done every 3 months or longer? And that is because, believe it or not, your red blood cell has a lifespan of 3 months. So there's no point in doing this test any quicker or any sooner than every 3-month intervals. And most people, once they're in a stable situation, usually have it done every 3 to 6 months or every 6 months to 12 months, meaning once or twice a year, just to check and make sure that the condition is stabilizing and responding favorably to medication. So the test parameters: below 5.7% is considered normal. 5.7 to 6.4% is considered a pre-diabetic situation. And above 6.5% is considered confirmatory for diabetes. So how does that translate? Because this test, although it is a percentage, is reflective of what your blood sugar is on an average day-to-day basis over those 3 months or 90 days. So it is believed statistically, because I did all the charts here, that a reading of below 5.7 or at 5.7 means your average blood sugar day-to-day is about 117 milligrams per deciliter. Between 5.7 and 6.4%, it's believed your average blood sugar is 117 to 134, and 6.5% or above, which is considered diabetic in terms of the A1C test, is reflective of an average blood sugar of 140 milligrams per deciliter. So if you are diabetic, you should know this number already, meaning the A1C test and what your test is. The gold standard, and I do want to put this with a little disclaimer here, the gold standard is that persons with diabetes should aim for an A1C level of 7%. That has changed over the years for a variety of reasons. One, people with diabetes oftentimes have a lot of other medical conditions. They're on multiple medications. They may live alone. All these factors come into play here. And so you don't want to take your blood sugar too low, or you might not be able to take it too low if you're on, for say, example, long-term steroids, which are known to bump up your blood sugar. So there are some caveats in which the goal of 7% is not unrealistic for certain people. Older persons are also usually not given a very strict number, such as 6.5 or 7%. I have seen several people handle it much better at 7.5% or 8%. That's my experience as a registered nurse. So those are the numbers. 6.5% for an A1C level, and that is reflective of an average of 140 milligrams per deciliter of blood sugar day to day. So this test can be done just without pre-planning. I'm laughing because without scheduling it. So, and I'll explain where I'm going with this. I have taken care of persons with diabetes and pre-diabetes, and I have family members and friends in the same situation. And if they know that they're having blood tests done at the doctor's office, they eat rather clean for several days before that test, and they kind of influence that test, meaning if I'm having blood tests done that morning, for a couple days I'm going to eat ultra clean and not have any sugar and blah blah blah, and I'm going to be fasting, and you could impact those results here. So the same with a random test. As I said on a previous video, a random glucose test, day to day, you may negatively or positively influence. The thought being that the A1C test is a much better snapshot, if you will, of an extended period of time, because you can't influence this, a couple days out. This is a 90-day window, and unless you're going to, really do what you should be doing and eating healthy and clean diet for 90 days out, you really can't influence that A1C test that might be done at a doctor's visit or at a clinic visit. So I smile because a lot of people, they're like, I just impacted my diet this past week in a positive way, and my, blood sugar was normal in a doctor's office, and then they go and have a big breakfast to celebrate. So beware, because the long-term compounding effects of that kind of behavior might come back and bite you here. So an A1C test, like I said, done for a confirmation for diabetes. It's considered the gold standard. It's much more accurately reflective of a longer period of time to see what is going on in the day-to-day for a 3-month period versus just a snapshot of a fasting blood sugar or a random glucose test. So please take the time and comment on this video and let me know. I would love to know actually what happened if you have had this test done in terms of having it confirmed that you have diabetes or a pre-diabetic situation. What were you told at that point of impact in terms of changing your diet, your lifestyle, behaviors, your activity levels, and more? Because I think we've got some great ideas for future videos. But for now, thank you for your time. Thanks for coming along on the journey, and I'll see you tomorrow on day number 9 of this 10-day challenge. Have a great day. Thank you.